This video will show you how to use the emboguide tool during a TACE procedure. In this TACE procedure, several tumors will be treated with drug-eluting microspheres, loaded with anti-cancer drugs. First, the physician will look at the pre-procedural CT images to see where the tumors are located. The patient has now entered the room and is placed as far as possible to the head end of the table. This is very important, since you will have the ability to perform the procedure with the C-arm in propeller position and still be able to visualize the groin when necessary. The patient is covered with sterile drapes, and the OR staff is preparing the room and the materials which will be used for the procedure. When all preparations have been done by the scrub nurse, the interventional radiologist scrubs in. The radiologist starts the procedure by explaining to the patient what will happen in the next minutes of the procedure. Once the introducer needle is in place, a short guide wire is advanced into the needle, and the system is brought into working position. Here you see the C-arm can reach the groin in propeller position, due to the positioning of the patient as high as possible on the table. The correct protocol is selected on the TSM for the right procedure acquisition program and Flex Vision monitor layout. When access to the femoral artery is established, the short guide wire is advanced and the needle is replaced by a sheath. Once the sheath is in place, the catheter and guide wire are introduced into the femoral artery. The catheter is advanced into the celiac trunk and an acquisition is made to check the flow dynamics. Now the catheter needs to be advanced into the common hepatic artery. This is done with the help of the 2D roadmap function. The catheter is advanced from the femoral artery to the celiac trunk, and then more selectively via the proper hepatic artery into the right hepatic artery. Once the catheter is in the correct position, the system is set up to perform a dual expert CT scan. To have an optimal result, the patient's arm should be out of the X-ray beam to avoid streak artifacts in the CT volume. Hands under the head will be the best position if this is possible. Also take care that no wires and infusion lines are hanging from the table. Be sure the lead shields are out of the C-arm pathway to prevent collision during setup. The proper injector protocol is set on the power injector. The detector is rotated to the landscape position. Check in the AP position if the liver is in the region of interest by pressing the fluoroscopy foot pedal. It's important to have the liver in the center of your image, especially when you're using Expert CT Open. This is a great benefit and will enable you to completely image the liver. Check in the lateral position if the liver is in the region of interest by pressing the fluoroscopy foot pedal. Make sure when doing this that you only adjust the height of the table, since we already centered the liver in the AP position. Select the appropriate dual expert CT open trajectory protocol. Set the X-ray delay time and the interval time. Now press the accept button and move the C-arm to the end position. You should be aware that during the expert CT dual setup, the bodyguards are active. Press the accept button again to move the C-arm to the start position. The patient will receive breathing instructions and an explanation on how the expert CT scan is performed. Since this will be a dual expert CT scan, there's an interval time between the two expert CT scans. This can be used for the patient to breathe in between. Press the acquisition button in the control room. The Expert CT starts with an X-ray delay. During this delay time, the contrast injection is already starting to have a perfectly filled vessel tree. The images of the arterial phase are sent in real time to the interventional work spot. After the arterial Expert CT scan is performed, the patient can be asked to breathe superficially just before the next Expert CT scan. Hold the acquisition switch until both Expert CT scans are required. Meanwhile, the interval time is displayed on the monitor. After the Expert CT dual acquisition, the patient's arms can be put next to the body for more comfort, and the injector is disconnected from the catheter. On the left, the arterial phase will be present, and on the right, the late phase will be present. Zoom the volume and scroll through both volumes to check if all structures are clearly visible and to check if all lesions are in the volume. If you're satisfied with the result, you can merge the arterial and late phase with the spacing slider and scroll through the volume to check if both volumes are matching. Proceed to the emboguide application. The application opens automatically in the segment phase. The late phase will be visible and the arterial phase will be hidden. Select a single viewing pane and scroll through the Expert CT volume to identify the lesions for treatment. When a lesion is identified, press the New button. Click on the lesion, hold the left mouse button and drag the mouse until the complete lesion is covered. Repeat these steps until you have segmented all lesions. Scroll through the Expert CT volume to check if all lesions are segmented properly. It's a good idea to check the segmentation in all the different planes. Zoom in on all lesions and check if they're properly covered by selecting a single lesion. When all lesions are identified, proceed to the planning step. Select the axial view for the best view on the rib cage and the spine to get a good overview of what to cut out. Select the 3D volume single pane for an optimal view. Rotate the volume so that the ribs and spine are not overlapping the vessel structures. Select Cut and draw the yellow line around the ribs and spine. Be careful not to take out the tumor or vessel structures. These will not be visible anymore during the procedure. The next step is to identify the catheter. Rotate the volume to obtain a clear view on the catheter. Select the Set Catheter button and move the mouse pointer to the catheter in the 3D volume and click on it. A green dot is placed in the catheter to identify the position. Notice the Set Catheter button has now changed into the Add Feeder button. Now that both the tumors and the catheter positions are defined, emboguide is able to determine the feeder paths. Select Auto Detect to find the feeder paths from the catheter to the identified tumors. As you can see, the algorithm detects the feeders automatically. Sometimes a feeder is not detected automatically. This can be due to lack of contrast, patient movement, or a mismatch in the registration. It is still possible to add feeders manually. Select the Add Feeder button and click on the tumor to add feeder manually. emboguide is still able to add the correct vessel path. Check the result in all planes and see if all feeding vessels follow the correct path with the Follow Selected Feeder slider. Once satisfied with the result, proceed to the guidance step. A 3D roadmap becomes visible on the interventional work spot. In the roadmap, the vessel paths to the tumors are visible. When the microcatheter is in place, an acquisition is made to check if the catheter is in the correct position to embolize. Contrast material and the embolization beads are administered to the tumor tissue. Since multiple tumors are identified with emboguide, it's easy to go to the next lesion after the first tumor has been embolized. an acquisition is made to check if the catheter is in the correct position for the next embolization. To prevent reflux, the catheter is further advanced into the feeding artery. This means that all administered embolization material will flow to the tumor tissue and not to healthy tissue. We hope that you found this video useful, and we thank you for your attention.